is adrenergic receptors and their effects on target organs. The outline of this presentation will consist of the types of adrenergic receptors, the location and the functions of these receptors, and the effects of sympathetic stimulation on various target organs. So to start off with adrenergic receptors. The adrenergic receptors are of two types, alpha receptors and beta receptors. The alpha receptors are further subdivided into alpha 1 and alpha 2 receptors, and beta receptors are further subdivided into beta 1, beta 2 and beta 3 receptors. So how do the adrenergic receptors work? All adrenergic receptors function through G protein coupled receptors. The alpha 1 receptor is linked to GQ subunit of the G protein, which stimulates the phospholipase CYP3-DAG pathway, which enhances the release of calcium, and increased calcium concentration results in contraction. The alpha 2 receptor is linked to GI, that is G inhibitory subunit of the G protein, and inhibits the enzyme, that is adenylyl cyclase enzyme, which decreases the formation of cyclic AMP, resulting in an effector response. Moving on to beta receptors, all beta receptors are coupled to GS, that is G stimulatory subunit of the G protein, which results in stimulation of adenylyl cyclase enzyme, increasing the cyclic AMP formation, and this results in an effector response. The alpha 1 receptors are located postsynaptically in most smooth muscles, such as the smooth muscles of the blood vessels, urinary bladder, prostatic urethra, uterus, and GI smooth muscle. At most of the smooth muscle sites, the function of alpha 1 receptor is excitatory, with the exception of GI smooth muscle, where the function is inhibitory, that is, they cause relaxation. So, stimulation of alpha 1 receptors of the smooth muscles of the blood vessels causes vasoconstriction and increase in peripheral vascular resistance. The stimulation of alpha 1 receptors at the radial muscle of the iris causes contraction of radial muscle of the iris, leading to dilatation of the pupil or mydriasis. This type of mydriasis is also known as active mydriasis. Next site. Alpha 1 receptors are located in the urinary sphincter, and stimulation of alpha 1 receptor leads to contraction or closure of the sphincters, and this fosters urinary retention and decreases urinary flow. Alpha 1 receptors present in the uterus responsible for increased smooth muscle tone of the uterus. Alpha 1 receptors present in the GI smooth muscles causes relaxation of the GI tract, leading to decreased tone and decreased motility. It also causes contraction of the GI sphincters, leading to closure of the sphincters and decreased peristalsis. Alpha 1 receptors are also present in the liver cells, where it stimulates glycogenolysis, that is, a process that enhances breakdown of glycogen to glucose. Location of alpha 2 receptors and stimulatory effects of alpha 2 receptors. The actions of alpha 2 receptors are mostly inhibitory in nature. Alpha 2 receptors are present in the presynaptic neurons, where they inhibit the release of norepinephrine from the adrenergic neurons and decrease the release of acetylcholine from the cholinergic nerve endings. The alpha 2 receptors present in the pancreas inhibit the release of insulin. Stimulation of alpha 2 receptors in the platelets inhibit platelet aggregation, and alpha 2 receptors that are present in the central nervous system decrease the sympathetic discharge. So these are the overall effects of alpha 2 receptor stimulation. The alpha 2 receptors are located presynaptically in the adrenergic neurons. The function of alpha 2 receptor is to inhibit the release of noradrenaline from the adrenergic nerve terminals. So it serves as a part of negative feedback loop, helps to regulate and control the release of norepinephrine into the synaptic cleft. Alpha 2 receptor acts as an autoreceptor, where it is present in the adrenergic nerve endings, inhibiting the release of noradrenaline from the nerve terminals. It acts as a heteroreceptor when it is present in non-adrenergic nerve ending such as the cholinergic nerve ending where it inhibits the release of acetylcholine into the synaptic cleft. Next is beta-adrenergic receptors. The beta-adrenergic receptors are divided into three subtypes, that is beta-1, beta-2 and beta-3 receptors. Beta-1 receptors are located in the heart and stimulation of beta-1 receptors of the heart increases the heart rate, that is chronotropic effect, increases the contractility, that is inotropic effect, increases the conduction via AT node, that is bromotropic effect, and it increases the ejection fraction, thereby increasing the cardiac output. The second site of beta-1 receptor is the juxtaglomerular cells of the kidney. Stimulation of beta-1 receptors of the JG cells of the kidney enhances the release of renin. Renin stimulates angiotensin-aldosterone system, resulting in angiotensin II formation and aldosterone synthesis, which is responsible for vasoconstriction and sodium and water retention. Beta-2 receptors are located in the smooth muscles of the blood vessels, the uterus, urinary bladder, the bronchial smooth muscle. The overall effect of beta-2 receptor stimulation is relaxation. Beta-3 receptors are present in the adipose sites. Stimulation of beta-3 receptors results in activation of hormone-sensitive lipase enzyme which stimulates lipolysis, that is enhanced breakdown of triglyceride to free fatty acids and increases the concentration of fatty acids. The adrenergic receptors that are present in the lungs are beta-2 receptors which are present in the bronchial smooth muscles, alpha-1 receptors which are present in the blood vessels supplying the bronchial mucosa and the nasal mucosa. Stimulation of beta-2 receptor causes dilatation of the bronchial airways, and stimulation of alpha-1 receptors of the blood vessels supplying the mucosa causes constriction of the blood vessels, thereby causing shrinkage of the mucosa and increasing the diameter of the airways. So this enhances the oxygen uptake and increases the oxygen concentration in the lungs. The effects of sympathetic stimulation on GI tract. The adrenergic receptors that are present in the GI tract are alpha-1 receptor, alpha-2 receptor and beta-2 receptors. The alpha-1 receptors are predominantly present in the sphincters of the GI tract and are responsible for contraction of the sphincters on stimulation. The alpha-2 receptors are present in the presynaptic nerve ending of the cholinergic neurons, and stimulation of alpha-2 receptors decreases the release of acetylcholine. So decreased concentration of acetylcholine decreases the tone of the smooth muscle, thereby decreasing the peristalsis and motility of the GI tract. Stimulation of beta-2 receptor causes relaxation. Next, the effect of sympathetic stimulation on genitourinary tract. The adrenergic receptors which are present in the bladder are the beta-2 receptors which are present in the detrusor muscle and alpha-1 receptors which are present in the urinary sphincter and the prostatic urethra. Stimulation of beta-2 receptors of the detrusor muscle causes relaxation of the bladder, and alpha-1 receptor stimulation results in contraction of the urinary sphincter and trigone of the urinary bladder. So sympathetic stimulation results in urinary retention and decrease in the urinary flow. Alpha-1 receptors are also present in the vas deferens and the seminal vesicles. Stimulation of alpha-1 receptors causes ejaculation. Next, what are the metabolic effects resulting from sympathetic stimulation? Action on liver. Stimulation of beta-2 receptors of the liver results in glycogenolysis, a process that involves breakdown of glycogen to glucose. The effect on pancreas. The pancreatic cells consist of beta cells and alpha cells. The beta cells contain alpha-2 receptors and alpha cells of the pancreas contains beta-2 receptors. So stimulation of alpha-2 receptors of the beta cells of the pancreas inhibits the release of insulin, and stimulation of beta-2 receptors of the alpha cells of the pancreas enhances the release of glucagon. So inhibition of release of insulin and enhanced glucagon secretion results in hyperglycemia. Next, effect on adipose tissue. The adipose tissue has beta-3 receptors. Stimulation of beta-3 receptors activates the hormone-sensitive lipase enzyme, which enhances the breakdown of triglycerides to fatty acids and increases the concentration of fatty acids. The effects of sympathetic stimulation on secretions from the glands. Salivary glands. Sympathetic stimulation reduces the salivary gland secretions as a consequence of reduced blood flow resulting from vasoconstriction. Effect on lacrimal glands. Sympathetic stimulation has no effect on lacrimal glands as the lacrimal glands have no sympathetic innervation. However, sympathetic stimulation can result in increased sweating because the sweat glands are innervated by neurons that are sympathetic in origin but cholinergic in character. So sympathetic stimulation results in increased release of acetylcholine resulting in increased sweating. The effects of sympathetic stimulation on blood vessels. The vascular smooth muscle tone is governed by beta-2 and alpha-1 receptors. Stimulation of beta-2 receptor promotes vasodilatation and alpha-1 receptor stimulation causes increase in arterial resistance. However, skin, mucosal, splanchnic and venal blood vessels have predominantly alpha-1 receptors. So alpha-1 receptor stimulation leads to vasoconstriction and decreased blood flow to the skin and mucosa on sympathetic stimulation. The renal blood vessels have alpha-1, beta-1 and D1, that is dopamine receptors in the smooth muscles of the renal blood vessels. So this helps to dilate the renal blood vessels and helps to maintain perfusion of the kidney. The coronary blood vessels have beta-2 and alpha-2 receptors. Beta-2 receptor is responsible for dilatation of the coronary arteries and helps to maintain the blood flow, while alpha-2 receptors present in the endothelial cells of the artery release nitric oxide, which causes vasodilatation and helps to maintain the blood flow to the heart. The skeletal muscle blood vessels are dilated on sympathetic stimulation, and this is due to beta-2 effect. The pulmonary blood vessels have alpha-1 and beta-2 receptors. However, the alpha-1 effect dominates over beta-2 effect. Therefore, sympathetic stimulation results in constriction of the arteries rather than dilatation of the arteries. Therefore, when a person faces a stressful situation, a life-threatening condition, there is activation of the sympathetic nervous system, which prepares the body for fight and flight response. In such a situation, the skeletal blood vessels are dilated to meet the demands of the exercising muscle. The coronary blood vessels are also dilated to supply enough blood to the heart to maintain the oxygen supply to the heart. The blood vessels of the skin, mucosa, splanchnic blood vessels and pulmonary blood vessels are constricted. So this helps to divert the blood from the skin, splanchnic, pulmonary blood vessels to the heart and the exercising muscle and prepares the body for fight and flight response.
These are my references. Thanks for watching. Please like, subscribe and share.